Diana was killed in a car crash in 1997 when Prince Harry was 12 years old. The Prince made the remarks at a charity barbecue in support of mental health. He says it's important for people to realize that anyone can suffer from mental health issues. For more, I'm joined by Dr. Katy Kamkar. She's a clinical psychologist at the Centre for Addiction and Mental Health in Toronto, a pretty high-profile person talking about the need to speak out after losing a loved one. How can talking help, Doctor?
Normalize the talking about mental health and mental illness, just as it's so normal to talk about any physical health issues. We really need to normalize the talking about mental health problems. With 1 in 5 individuals being affected, no one is immune to it. So we all affected by mental illness, whether it's directly or whether it is indirectly. So we need to very much further work on reducing the stigma, normalizing the talk, and very much understanding that talking about it and also seeking help is actually a sign of strength, is a sign of resilience, and definitely a sign of courage.
Why are some people so resistant to it still then?
Well, there are a variety of reasons. Definitely stigma is a very predominant one that leads to self-isolation and to very much suffering in silence. And at times also the attitude from others that can be sometimes dismissive, attitudes such that, oh, you know, relax and get better, or just sleep and tomorrow will be a better day. So those dismissive attitudes as well can very much lead to more self-isolation. So we have made a lot of improvement over the past several years. We definitely have a further work to do, and I think it's very important to talk about it, continue to talk about it, to open dialogue, open the communication, and just as we can easily talk about medical issues, we really want to normalize the talk about it, and very much understanding that this is a sign of strength and a sign of courage and resilience.
Prince Harry was only 12 when Diana was killed. What kind of effect could the loss of one's mother have on someone that age? I mean, obviously so traumatic, and being in such a public position as well.
Definitely. The loss of a parent is probably the most tragic loss, the most difficult loss we have to go through in our life. It's already difficult for an adult to go through the loss of a parent, let alone a child. For every single person is very different. People process the loss and the grief differently, but it's important that at any age to be provided with an atmosphere of openness, of an atmosphere of courage and warmth and comfort, and to understand that there is no right or wrong feeling, and we need to feel comfortable to express any feelings that we have, any thoughts that we have, any fear that we have. So it's important to be provided with that atmosphere. And again, everyone goes through it quite individually.
Dr. Katy Kamkar is a clinical psychologist at the Centre for Addiction and Mental Health in Toronto. Thank you for your time.
Thank you.